So once the theatre team have got you on the table and the anaesthetist got you nicely asleep, what the surgeon will do is insert a port into your stomach, and this is called a camera port, and it'll be the biggest incision that is made, and the camera will go inside your stomach, and then they will fill your stomach with gas. Now this gas is carbon dioxide gas, and it blows your stomach up quite a long way so that all your organs and abdominal fat drop, so that the surgeon can see your stomach and see what he's working with, and just make sure that he's got enough room to work in there. The next thing that he will do is insert several different ports to put his instruments in, but the one that you've probably heard quite a bit about and maybe are horrified about is the liver retractor. The liver retractor goes in and it's basically just a metal instrument that goes in through a port and pulls the liver up out of the way, because the liver is in quite close proximity to the stomach. Once that's in and all the instruments are in, the surgeon will start to do his operation. Sleeve, bypass or band, normally the same amount of instruments do go in. The surgeon may find that he might need to put a couple more in if the access is difficult. After all, he doesn't know what he's working with until he gets in there. All the time while this is happening, the anaesthetist is sat at your head, watching your blood pressure, watching your pulse, watching for any signs of pain, and are giving you any drugs that you may need during that operation. You'll also be given fluids to keep you hydrated. After the end of the surgery, the surgeon will do any test that he needs to do. If you've had a gastric bypass, they need to test that all the joints are working properly. So they'll pass a dye through into your stomach and into your bowel. So you may find that when you wake up, you're tinged with blue around your mouth. That's completely normal. The dye is bright blue. And then they'll take the ports out and try and take most of the gas out of your stomach. Now, sometimes this is quite difficult to get all the gas out of your stomach, and you might find that you'll suffer with shoulder tip pain and trapped wind pain when you wake up. And this is nothing to do, you're not having a heart attack, it's nothing to worry about. It is trapped gas pain, and it can actually be quite severe, worse than the pain in your stomach from the surgery. The anaesthetist will wake you up in the operating theatre. You'll wake up to somebody shouting your name probably, and pull out the breathing tube. Luckily, you won't remember any of this, and then the anaesthetist and the theatre team will wheel you into recovery.